Top 10 ways to protect yourself against the COVID-19 virus.
Okay.
Hi, everyone. I hope that you've all been doing okay during this crazy time. It's been a pretty surreal feeling 7 to 10 days here. I know that we're all missing our work, missing our friends, missing our family, and it's been incredibly difficult and trying. So we're really just trying to do anything here to connect, even if it is virtually. We really want to get you some good advice and info here so we can really do our best to flatten the curve, decrease the rates of infection, and try to get this over with as soon as we can. It's unlikely that many of you know this, but I am an executive director on the Provincial Naturopathic Association. We've been monitoring this situation extensively. We've been checking in with the BC, CDC, and Health Canada. We are staying up to date with statements from our provincial health officer, Dr. Bonnie Henry. And I've been sitting personally through hours and hours of webinars trying to get as much information as possible about this virus so that I can bring the best information to the clinic, to our patients, to our community. At this time, BC naturopathic doctors are reiterating the same message that the Provincial Health Authority is saying. And I really want to go through some of the most important things so that you can help to prevent contracting and transmitting the virus. So I am going to touch on nutrition. This is NutriFit. I'm going to be establishing the NutriFit pillar for the BackFit Clinic here. But I really do want to go over a few other things. Because of the novelty of the virus and all of the unknowns with this, I'm not really going to be making any supplement recommendations for a few reasons. Okay, number one is your safety. Without knowing your personal health history and your situation, it is irresponsible of me to make any recommendations. So I really don't want to do that. Number two is efficacy. I don't need people going out there and buying low quality supplements, vitamins and minerals that may or may not work or potentially do harm. So supplement recommendations are not going to be happening today, but nutrition is. We're learning lots every single day. This situation is changing so rapidly, and we're going to be doing our best to keep you as up to date as possible. Before we begin, I do have to emphasize that this is fairly general advice, and I am not your doctor. If you do feel like you have a COVID infection, the best thing you can do is visit the BC CDC website. And once, I've got a crazy cat down there pawing at my legs. Sorry. The best thing you can do is visit the BC CDC website or the Health Canada self-assessment tool. If it is an emergency, and that means you're experiencing some of the top reported symptoms of a COVID-19 infection, that would be a fever, severe difficulty breathing, severe chest pain, having a hard time waking up, feeling confused, losing consciousness. If you are experiencing any of those, you should call 911 immediately or report to your nearest emergency room. If you do not have an emergent condition and you are looking for support with your overall health and immune system, I would be happy to arrange a telemedicine consult with you. You can contact the BackFit Clinic or email me at drmorton@backfit.ca, and we can set something up to get you feeling as healthy and robust as possible. Okay, so we're going to transition here and get into the top 10 things that you can do that I can recommend to keep you feeling healthy and well through all of this. So if you don't have a pen and paper with you right now, I just want you to take a sec, grab something, because I do want you to jot these down just so that you can take this information and apply it afterwards. Okay. Number one, far and away, the most important thing that we can do is social distancing. What does this mean? There's still some confusion around it, and I really, really want to drive this point home. I'm sitting at home here right now. I didn't go into the office. We're limiting the amount of contact we have outside of our place, and that's the most important thing we can do. So aside from the people that you live with, this means keeping about a 2-meter distance away from people outside your home. Why is this important? Why are we so concerned about coming into contact with other people? The longer we come into contact with others, the higher the likelihood of transmission of the virus is. The virus can also live for up to about 3 days on certain surfaces. So when you are outside your home, the chances of you touching a doorknob, a handrail, picking up something at the grocery store that somebody else has touched, not to scare you, but this virus can live for quite a while on different surfaces. So we're really trying to decrease the amount of time that we have, we're exposing ourselves to the likelihood of transmission. So a new poll, this is something interesting and kind of saddening. A new poll shows that up to 30% of Canadians still think it's fine to hold a gathering of up to 10 people, thus defying Health Canada officials' guidance. And I can't express enough how you should not do this. You really need to stop having these large get-togethers. We were down at the beach a few nights ago. Just the two of us keeping our distance, but we saw groups of 15, 20 people still getting together, and that is not what we should be doing at this time. Social distancing also does not mean just people that are over 65 or immunocompromised. Those may be the people who are at the highest risk of contracting COVID and also having bad consequences, but they're not necessarily the ones who are going to be transmitting it. Anybody can transmit it. You can be an asymptomatic carrier for days or even weeks sometimes. So just because you are young, feel well, and think that this does not apply to you, it does. And you should use, every effort you can to decrease that transmission. Okay, number 2, practicing good hygiene. We've been hammering this one home for the last few months, and I mean, we've been hearing it since we were in kindergarten at school. Wash your hands. It's such a no-brainer, but it bears repeating. You really want to make sure that you spend a good 20 seconds, hot soapy water. Doesn't actually necessarily need to be hot, but soapy water, 20 seconds with good scrubbing, good hand washing technique. And why do you want to do this? A quick 5-second scrub with just water and then, wring them out like that, that's not going to do it. That's not going to actually lift and clear bacteria and viruses off your hands. So a good 20-second wash is what you want to do. You can also use a 70% alcohol-based hand sanitizer. That's going to do an effective job as well. A couple other measures that you might want to take into consideration here. You should definitely take into consideration here. Coughing into your elbow, if you are going to cough, right? Decrease the amounts of germs you have on your hands. If you feel ill at all, stay at home. Don't put anybody else at risk. And if you think that you have come into contact with somebody, do the self-quarantine. There's no harm in that. Make sure that you are cleaning and sanitizing frequently used objects like your cell phone as well. There is actual cell phone wipes that you can get. And so, you can use those, or without damaging your cell phone, sometimes even alcohol-based swabs can clean it as well. Right, number 3, good quality sleep. This is something that I try to get with each and every single one of my patients. It is so crucial and so important. And right now, I think that we have a pretty unprecedented opportunity here to really focus on getting good sleep, right? I mean, we're at home so much already, so use this as an opportunity to get into a good routine with your sleep, right? Right now, a lot of people I know are up late. They're checking Facebook. They're watching news reports. They're learning all the latest doom and gloom, and they're freaking out right before they go to bed, and this is exactly what you do not want to do. Okay? Maybe it's important to check in with some family members and loved ones, but don't just go down a rabbit hole, COVID-19, and spend an extra 2-3 hours staying up in bed, not sleeping. I want you to turn your cell phone off, turn your TV off, decrease the amount of blue light that you have coming at you from those screens at least an hour, maybe up to 2 hours before bed. Really, really cannot emphasize that enough. Number 4 is regular exercise. So Dr. Bentham and Dr. Bartlett are going to be going through exercise ideas more thoroughly later this week for both your body and your spine. But there are so many amazing at-home workouts you can do right now. If you search on Instagram and YouTube, there is an amazing community out there live streaming and giving them away for free at-home workouts. Why not utilize it, right? Try a few different classes, do some yoga, do some Pilates, do some HIIT exercises, have some fun with it, okay? Exercise has been shown to boost your immune function in the literature, so utilize it, okay? It can help protect you against the regular cold and flu and potentially could give you a little bit of protection during this. Alternatively to doing exercises at home, go for a walk, right? Out here in Victoria, it's a beautiful, sunny, kind of blustery day, but still not a bad idea to head outside, get some fresh air. The one thing that I do want to touch on, though, is that people are still getting outside and some places are really busy. We went for a hike up on Jocelyn Hill over the weekend. It was beautiful, but it was honestly a little bit too full for us to feel totally comfortable. So use this as an opportunity to explore Vancouver Island, right? Pull out the map, take a drive, check out somewhere new, try to get a little more off the grid and try to find somewhere where you're not going to be bumping into people and rubbing elbows, okay? Number 5, and you are probably not going to love this one. I know some people have been stockpiling this stuff just in case, but we should really think about limiting our alcohol intake during this time, okay? Overconsumption of alcohol can suppress your immune system, so this is definitely not something that you want to do right now. It disrupts your sleep cycle, which then compounds the effect on the immune system, so please be smart with your consumption. I've seen some hilarious videos of people doing wine tours around their homes right now, and it's funny and it's great, but honestly, if this turns into just one big binge drinking event for people, that is not what we want to come of this. So be smart with your consumption. Have a glass or two of wine with dinner. Absolutely. That's great. But just, watch on the overconsumption. Number 6, avoiding processed and refined foods. Why? Why should I be avoiding my French fries and samosas and hamburgers right now? Well, these foods are inflammatory in nature, and when it comes to balancing your immune system and for just general overall health, these are not really the foods that are going to make you feel your best. These are foods with added sugar, fat, and salt. These are things that are deep fried. They often come in boxes and bags. This is a fairly simple one, but I really just want to focus on getting nutrient-dense foods into you right now. And I get it. Right now, we're probably gravitating towards some of our favorite comfort foods, and I 100% understand. But, try to focus on like an 80-20 or a 90-10 kind of rule. Really try to make the majority of what you eat health-promoting foods rather than something that's going to flare you up and not help your health out at all. So, number 7, on that note, nutrient-dense foods. All right, I'm here to spread the NutriFit message, and I really want to dive into this one. I want to focus on nutrient-dense foods. So instead of eating calorie-rich, nutrient-deficient foods, which is what that standard American diet is, we really want to focus on foods with high vitamin, mineral, and antioxidant content. So for me, personally, this means a lot of leafy greens, brightly colored fruits and vegetables, legumes like lentils, chickpeas, black beans, lots of berries. We're eating lots of fermented foods, tons of sauerkraut. We're just hammering through our jar of it right now, and it's awesome. Why do we want to consume these? The mineral vitamin content of these is high, and I want to just go through a couple of my favorite ones and some of the best foods you can get. So vitamin C, super important antioxidant. It promotes the immune system on multiple levels. My favorite food for this, kiwis are extraordinarily high, red peppers are really high, and of course any citrus fruit, your oranges, your grapefruits, lemons, limes, stuff like that. Leafy greens, I try to recommend leafy greens to each and every single one of my patients. I think these are a multivitamin, multi-mineral, super nutrient-dense food. They can be high in vitamin C, K, iron, beta-carotene, folate. Really kind of depends on which one you're eating for different levels. But that's why I love mixing it up, right? So I'm usually having spinach, arugula, romaine lettuce, kale, different types of kale all throughout the week just to make sure that I've got a good variety of leafy greens coming in. You can throw these into a smoothie, blend them up. You can juice them, right? Like some kale, ginger, pear, cucumber, something like that. It makes a fantastic juice. We throw them into soups and stews, or of course you can make a salad. Super easy. Nice, great thing to include. Kale, one of those leafy greens. It's part of the cruciferous family of vegetables. So things like broccoli, cauliflower, asparagus, Brussels sprouts, those are all in the same family, and they're high in something called sulforaphane, which is important in augmenting glutathione, which is a key antioxidant in your body and liver. So we really want to try to keep that high right now. So the more cruciferous veggies, broccoli, cauliflower, asparagus, Brussels sprouts, kale, you can eat, the better. Berries are amazing for their antioxidant content, right? There's a low glycemic index. They're not going to spike your blood sugar, high in fiber. They're delicious. Why not include some berries? Consume them with some nuts and seeds for a little bit of protein and fat too. Makes for a fantastic snack. On that note, nuts, seeds, and oats even, super high in zinc content. So zinc is important for helping to heal wounds. It's an important immune cofactor, helps you grow. So why not, have some nuts, seeds, oats as well. One of my favorite foods when it comes to immune health for nutrient density as well is garlic. So garlic has a lot of interesting factors in it that are antimicrobial and antiviral. My favorite way to use garlic is chopping it, crushing it, exposing it to air for about 10 minutes before you cook with it. It just helps to make some of those properties a little bit more active. So, in your stir fries, in your, I'll do a little bit of kale, ginger, garlic, and soy sauce, just something like that. There's lots of ways to use garlic, so definitely use it. One important aspect with all these foods, along with the legumes and fermented foods like sauerkraut, they're extremely important for our gut health. And I'm going to touch on this in a later NutriFit session, all about why the gut is so important with your immune system. But I just got the notice my internet is Unstable. Hope everything is still going okay. So our gut health is important. Our gut makes up for about 70% of our immune system, and a diet rich in different fruits, veggies, and fibrous foods is really going to help keep it thriving. I personally aim to eat about 40 different types of fruits, vegetables, legumes, and grains a week to really kind of promote a diverse gut flora. So try your best to increase the diversity. Best way to do all this and to include a lot of these foods that I was just talking about is making something like a Buddha bowl or a dragon bowl. There's lots of different names for it. Essentially, you've got a brown rice or a quinoa base, mixed greens on top of that, a few veggies, peppers, onions, mushrooms, broccoli, a scoop of lentils or chickpeas, maybe some tempeh or tofu, a little bit of olive oil, a little bit of balsamic vinegar on there. You've got a delicious, nutrient-dense meal right there. So I'm actually going to include my favorite recipe for a Buddha bowl. We don't have it up yet, but check back on our Facebook page here or in the email that we're going to send for Dr. Morton's favorite Buddha bowl. We're going to have that coming at you. I would love to see people make it, eat it, let us know what you think. It's literally what I eat 70% of the time for lunch and dinner. So yeah, get in on it. It's fantastic. Okay, just to reiterate, when it comes to food right now, I really strongly recommend that you focus on a whole food, plant-based diet that is low in refined and processed foods. I know that it can be hard to find fresh fruits and vegetables right now. Dr. Doyle sent us a pic last night showing the shelves absolutely picked clean. I think it was at Red Barn. So people are out there, they're buying up fruits and veg and trying to fill their shelves with healthy food. But do your best, right? Maybe explore some of the other local produce people, Red Barn, Root Cellar, some of the farmers markets around Saanich. I know there's some really good stuff out there. Take this as an opportunity to go try and find some new people, try some new vegetables, right? Expand your repertoire of what foods you eat. Try a few new things. So that was number 7. That was a lot. I'm going to move on to number 8 right now. And these are going to be some good tips that I really want people to consider. Number 8 is working together as a community. So these are trying times, right? This is unprecedented and extremely difficult for a lot of people. And we really want to encourage you to reach out to a friend, a family member, a neighbor, or just somebody that might need some help. Maybe there's somebody who can't go to the grocery store. Maybe they are sick, immunocompromised, elderly, have mobility issues, whatever. If there is somebody that you can help by grabbing some groceries, some home goods, just take that opportunity to help them out. The stronger we are as a community, the better this is going to go. Don't just be that person hoarding toilet paper and sitting at home with your rolls and rolls and rolls of it, laughing at everybody else, right? Share, be kind, be nice, take other people into consideration and really try to grow as a community. Number 9, make your health a priority. Yes, social distance, absolutely, but don't isolate yourself from health, okay? So what does this mean? For me, what we've been doing here is trying to create a schedule, some sense of normalcy about our day, right? Schedule a workout, plan a walk, plan our meals, get in some meditation, a little time in the sun. Don't just go about your day cruising through Netflix, eating whatever. Take some time at the start of the day to think about what is important for me to do today. What can I do today to better my health and better the situation? Really, you don't, like we said, you don't have to isolate yourself from health here. Social distancing is important, but you don't have to do that. Number 10, last thing to go over today is be a leader, right? Be a leader in your community. Be a leader in your friend group. Be a leader amongst your family, right? If you get asked to go to a barbecue, to go down to the beach, take some time to explain to people why you're not coming and why social distancing is as important as it is right now. Okay, I think that we really do need more and more people to step up and take this seriously. And so I encourage you, be a leader and let people know what you are doing in your life, what you're doing for other people to have a good, positive impact. So those are my 10 things. And I mean, new information is coming out every single day, and we're going to do our best to keep you updated. I advise you to stay tuned in here. Check out the BC CDC information page to keep up to date. And I'm going to hammer this home at least one more time here. Practice social distancing as best you can. The sooner we take this serious, the sooner this situation is going to be over, and we can maybe get back to spending time with our family, friends, and loved ones. Okay? So you guys, everybody who's watching this here, I would really, really love for you to comment below, engage in a conversation, right? We're hurting for social contact right now. Much as I love my partner, she's the only person I've really been seeing lately. So give us a couple comments below. Let us know what you are doing to better your health. Let us know which of these 10 tips you are really going to take to heart and implement into your life and take seriously this week, right? If you're going to be focusing on nutrient-dense foods, if you maybe weren't doing the social distancing and now you're going to take it a little bit more seriously, how are you going to have a positive impact with your family, your friends, your community? Let's spark a little conversation down below here, right? Let's all get together, get some comments going, and yeah, stay in touch. So I think that's all I've got here today. I really hope that some of this information is of help to you. If you have any questions, comments, concerns, whatever, comment below. Shoot us an email at Backfit. Shoot me an email personally, drmorton@backfit.ca. If you do want to take some time to work on your health throughout this situation, we can set up an appointment, have a telemedicine consult, and this doesn't have to be a completely negative time. You can use this as a time to make some changes in your life and really come out better on the other side. So I hope this helped. Social distancing, say it one more time. Take care, everybody. We love and appreciate you. Thank you so much for tuning in. This is my first time doing a Facebook Live. I hope that it was okay. I didn't talk too fast and you got something out of it.
It was awesome, Doc. I appreciate it. And listen, can you hear me right now?
I can, yeah.
Okay. I was just going to say the last thing I would ask everybody to do is if there's specific things that you would appreciate us bringing up and developing content on, just please make sure to make a comment below. We're going to be looking at these and trying to address the issues as they come up. And we're going to be doing research and helping just to keep everybody up to speed so that we can get back to life as soon as possible.
Totally. Anyway, thanks for mentioning that. Yeah.
Yeah. Awesome job. And thank you very much. We'll talk to you guys Wednesday. I'm going to talk a little bit about anxiety and isolation and the strategies to overcome some of the situations that we're going to be facing. From now, have a great night. Bye for now.
Bye, everybody.